Molly was 46 when she started experiencing weight gain and high cholesterol, even though she'd not changed her diet or her exercise patterns. She was having some night sweats and was starting to become more forgetful. She was more tired than usual, and her moods were unpredictable. But when she went to her doctor for her yearly checkup, they told her that she was just getting older. She asked about hormone replacement therapy, and the doctor told her that HRT would not help. She told her that high cholesterol was just going to be her thing as she aged, and that weight gain was just part of getting older. Does this sound familiar? Well, she reached out to me, we started working together, and we changed the trajectory of her menopausal transition. Her symptoms improved. We got a handle on her cardiovascular disease prevention by utilizing naturopathic medicine and hormone replacement therapy. My name's Dr. Elise Schroeder, and for the last 20 years, I've been working with women just like Molly. I've consulted on thousands of hormone cases, and over the years, there have been patients who've been successful, and there's been patients who were not successful at getting relief. The most successful patients were those that kept an open mind enough to look at things from a different perspective, to take a leap into a comprehensive naturopathic approach rather than a reactive approach. And, I've been there. I have been in this position where I needed that kind of perspective. I myself had recurrent immune issues in my childhood and into college. I was always treated the same way with antibiotics and nothing else. I discovered naturopathic medicine as a pre-med student and found that it looked at illness from the perspective of the whole individual. And it took into account so much more than just that current symptom, just that virus, just that bacteria. This was mind-opening for me and life-changing, so much so that I became a naturopathic physician. This experience with my own health is one of the foundational reasons why naturopathic medicine and a comprehensive approach to health is so important to me. I experienced it, and now I've spent my life sharing it. Well, why is it important to you? What brought you to this video? Why are you looking for something more comprehensive? I imagine that you're here and you're giving your time to me and your attention to me because you too want to achieve better health. And of course, a reduction in symptoms. And also that you want that symptom relief to last and to live a full life without compromise. So here's what we're going to do today. For the next 20 minutes, we're going to discuss some of the previously held beliefs about perimenopause, menopause, and hormone replacement therapy. You'll get a sense of whether hormone replacement therapy is right for you at this stage of your menopausal transition. And we're going to talk about 3 things that you can start to do today to move the needle on your health. By the time you leave, you're going to have the information you need to have a smooth menopausal transition. So let's jump in. I like to start by gaining some perspective. Let's talk about the line of fine. It's this line here. Millions of people are dumped here in our healthcare system every day. It's near the reactive healthcare, where we only address our health when there's an infection or a symptom or a lab that requires a pill or a surgery. It's reacting rather than responding or preventing. It's that place like where Molly was at, where the doctor tells you, those symptoms you're having, they're fine. It's normal for your age. Your labs, they're fine. Everything's fine. That is not where I like to work. I like to work over here in the proactive health zone. In proactive health, we're talking about individualization. We're talking about multifactorial health. We're talking about looking at the body as a whole, evaluating all an individual's symptoms, all their systems, rather than just one symptom. We're talking about prevention. For example, if someone comes to me with a headache, I could just give a painkiller and be done. That would be reactive healthcare. Instead, I will give a painkiller. It could be an aspirin, it could be an herb, and then we go beyond that. We're looking, why is someone getting that headache? Is it a food sensitivity? Are they having muscle tension? Is it hormonal? What's the cause? And then we're going to treat that while alleviating symptoms with painkillers in the short term. That is proactive healthcare. Most people coming to see me, most people watching this video are somewhere over here. They're near the line of fine. They're interested in proactive healthcare. They're probably already doing things that are preventative or part of proactive healthcare, but they need a little more help getting fully into this zone. Where are you at? Think about that. Are you at the line of fine? Are you already over here? Or have you been landing more into the reactive healthcare zone? Think about that. The next thing I like to do is use this tool. It's a health assessment tool. I use this with all the people that come into my office. It helps orient people and can help orient you as to where you're at in your health journey. So get out a piece of paper and a pen, literally, get out a piece of paper and a pen, and keep score. Let's do a quick self-assessment. You're going to be grading yourself using red, yellow, or green. Green means I've got this, I'm good to go. Yellow is I kind of sort of have this, but it's not consistent. And red is holy smokes, I do not have this in play. So you're going to grade yourself and see how many of these milestones you've already hit. If you're all green, then you're good to go. And you're actually really ready for hormone replacement therapy now. If you're all red, then we have a clear path for you to start working on. Okay, so let's start with pillar 1. Pillar 1 is my hormone pillar. The first thing I look at with patients, have you had hormone symptom evaluation with testing and estrogen metabolite testing? We want to know where you're at in your menopausal transition. We want to know, do you process estrogen safely? We need to know this information moving forward for true proactive preventative healthcare. Milestone 2, are you avoiding endocrine disrupting chemicals? These are plastics in our food and our kitchen, and these are chemicals in our beauty products and more. Number 3 would be, are you having predictable periods? Can you predict? Do you know what they're going to be like? Is that occurring for you? Pillar 2, I call the digestion detox pillar. Number 1, are you having a daily, full, and easy bowel movement? So this is also going to be predictable. It's also going to be complete, easy to pass, a normal shape, a log, a normal color, brown, not a bunch of food, digested food and undigested food in your stool, etc. Milestone 2, you're having minimal bloating and gas. You might still have some, but you're not having foul smelling gas and your bloating isn't extreme. It's mild or to minimum, to none. And milestone 3, you don't have reflux and you feel a normal fullness after meals. Your appetite is normal. Pillar 3 is metabolism. And with metabolism, we're talking about more than just weight loss, weight maintenance. We're talking blood sugar control. Do you have blood sugar control, or are you on a roller coaster all day long, like many of us are? How's your energy? Is it the same that it's always been? Has it decreased, or are you increasing? I want to see that energy score increasing or staying at where it's always been your whole life. Milestone 3 is focus and brain power. So most women in perimenopause are having some issues with memory or focus or some kind of cognitive, mental functioning complaint. So I want to see that hasn't changed or is improving. So red, yellow, and green, I want you guys to be checking that out. I use these milestones to evaluate all my perimenopausal and menopausal patients. And some people ask, why do you assess milestones in 3 pillars and not just hormones? And that's because being a menopausal badass goddess requires addressing multiple systems in the body. To take HRT and to do nothing else would be reactive healthcare. To be proactive, you've got to address all these pieces. And that's what I'm considering a menopausal badass goddess. So how did you do? Were your results mostly green? If so, you're a superstar and head of the class. Are some yellow, some red? If you're like most people, you probably have a lot of yellow and reds, and you maybe are feeling a little overwhelmed about that. So let me share with you an abbreviated version. So This is the health shortcut to a smooth menopausal transition. If you can do nothing else, here are 3 milestones that if you can achieve, you can make a big difference in your hormonal symptoms. So, milestone requirement 1 in the hormone pillar would be avoid endocrine disrupting chemicals. Do your research, but basically, some of the biggest ones, the most common exposures we're getting are in the kitchen with plastics, plastic food containers, plastic bags, and then or plastic water bottles, etc. And then secondly, in our beauty products. So do an audit, check all your beauty products, see if there's any chemicals in there. And you can do a quick Google search and get the names of those endocrine disrupting chemicals. The most common ones are going to be phthalates and parabens. Milestone 2 is, are you having a regular bowel movement? If you're not, you may have some ideas about what you need to do to start having more regular bowel movements. And if so, do that. We want you to be having those regular, full, complete bowel movements every day. Milestone 3 would be get your blood sugar under control. A simple thing that you can do to regulate your blood sugar would be to eat 3 to 4 meals every day. Increase your fiber intake, which will not only help with blood sugar control, but also with regular bowel movements. If you can achieve these 3 pillars, you are definitely going to move the needle on your health. And we haven't even talked about hormone replacement therapy yet. So let's do that. And let's start by talking about some old science and deconstructing some of your previously held beliefs about menopause and hormone replacement therapy. Okay, so the old science. The old science is HRT is dangerous. Don't address symptoms until you're in menopause. Or, oh, my symptoms are just me getting older and I have no control over this. Now, let's talk about the actual science. HRT, hormone replacement therapy, is preventative medicine. If I had all of you in the room together with me live right now, I'd ask you to raise your hand. And if you've heard that hormone replacement therapy is dangerous, I guarantee you over 50% of you would have your hands raised. That's because when we were growing up into adulthood, the 2003 Women's Health Initiative came out. Millions of women were pulled off their hormone replacement therapy. Millions of women were left with no options but to suffer. And that's because the study, the 2003 Women's Health Initiative, was showing that the risks of hormone replacement therapy, in particular combined estrogen progestin therapy, progestin's the synthetic form of progesterone, the risks were greater than the benefits for many women. And the main risks included a higher chance of breast cancer, heart disease, stroke, and blood clots. Because of these findings, they just pulled HRT from all their patients and started rethinking, how do we treat menopause? But now, in 2024, we look back at that research. We have these 2 decades, 20 years of following women who got pulled off their hormone replacement therapy. And what we found is that the women that got pulled off of their hormone replacement therapy had a higher risk of dying from complications like breast cancer, cardiovascular disease, and dementia than the women who stayed on their hormone replacement therapy. The other big thing that we discovered is that it is the combination of the estrogen and the progestin, the synthetic progesterone, that really is the problem in that study, or that is the problematic formula. It's now, hormone replacement therapy is now considered an important part of preventative medicine for many women. It's seen as beneficial not only for alleviating menopausal symptoms, but also for reducing the risk of osteoporosis, reducing the risk of heart disease, and reducing cognitive decline. That's going to be dementia and Alzheimer's. Doctors we now recognize that when we tailor treatment to the individual, hormone replacement therapy can significantly improve your quality of life and long-term outcomes for women. It's considered preventative medicine. So I bet you're saying, yeah, but how about breast cancer? So let's talk about that. Drinking a glass of wine per dinner has the same risk of breast cancer as using hormone replacement therapy, and that is combined hormone replacement therapy. Studies show that having one drink per day can increase the risk of breast cancer, specifically one for every 1,000 women who have one alcoholic drink a day, there's one extra case of breast cancer compared to non-drinkers. This is in 1,000 women. So if you look at the numbers, both moderate drinking and using combined hormone replacement therapy for 5 years lead to a similar small increase in breast cancer rates, around 1 to 2 additional cases per 1,000 women. Here's the other thing. Some studies show that using hormone replacement therapy can actually reduce the risk of breast cancer. It's all about individualization. It's all about understanding for you what's going to be the best case and outcome for you. I want to put this risk into perspective, showing you that while there is an increase for some women, it's relatively small. And if you're using estrogen-only hormone replacement therapy, the risk is even smaller, and in some cases preventative. And if you're using estrogen and progesterone therapy, your risks are smaller as well. Ultimately, it's important to think about these risks along with your overall health and lifestyle choices and really evaluate that risk to benefit ratio. Now, if you're interested in learning more about hormone replacement therapy, check out this book, Estrogen Matters. It's an excellent primer for understanding why estrogen matters in perimenopause and menopause. It's really helpful for debunking many of the myths around HRT. It's written in an easy language and easy to understand language, and is packed with really great tidbits. So my only complaint is the author is kind of down on compounding pharmacies. And I love my local compounding pharmacies. They really help me tailor my treatment to the patients individually, especially when it comes to people who have sensitivities with certain additives or other things that Big Pharma might put into their formulas. So that's my only caveat. Otherwise, this book will be really helpful if you're interested in learning more. Okay, now let's dive into digestion and menopause. How does digestion affect menopausal symptoms like hot flashes, brain fog, and mood changes? How can that be? Well, digestion plays a crucial role in hormonal health, especially when it comes to estrogen. The gut microbiome, which is the community of microorganisms living in our intestine, help to detoxify estrogen. A healthy microbiome ensures that estrogen is properly metabolized and eliminated from the body. When your gut health is compromised, it can lead to an imbalance in estrogen levels, potentially causing symptoms like mood swings, weight gain, and other hormonal issues. So maintaining a healthy digestive system is key to keeping your hormones in balance and supporting your overall health. A healthy digestive system looks like this: 1 to 2 easy to pass and complete bowel movements daily, minimal gas and bloating, and no reflux or heartburn. So what about metabolism? Estrogen affects weight, energy, and other hormones. Estrogen has a significant impact on our metabolism and overall health. Estrogen helps to regulate energy levels by affecting the mitochondria. Mitochondria are powerhouses of our cells that produce energy. When estrogen levels are balanced, our mitochondria can work more efficiently, giving us the stamina that we need to get through the day. In terms of weight maintenance, estrogen helps control how our body stores and uses fat, which is why so many women are noticing weight changes during menopause when estrogen levels drop. It also influences how our body handles insulin and blood sugar. Helping keep these things stable reduces the risk of diabetes and insulin resistance, but also helps stabilize weight. And then there's the brain. Estrogen is very important for brain health. It supports your mood, your memory, and cognitive function. So keeping our estrogen levels balanced is key for staying energetic and maintaining a healthy weight, also for supporting brain function and ensuring our mitochondria are functioning well to support our metabolic health. Okay, so let me bring all these pieces together and give you a case study. This is Carrie. Carrie is not their real name. She's a confluence of a few of my patients. Her experience is just such a great example of what the journey of working with me looks like. So, Carrie is a 46-year-old woman who came to me with severe PMS, and this was new. She never had PMS before perimenopause. In her younger years, she didn't have moodiness before her periods. Her periods were regular, no breast tenderness, but suddenly she was weepy, angry, short, and irritable with her kids and her partner. When her period did show up, they were becoming irregular. Sometimes she was bleeding heavy, sometimes minimally, sometimes she was getting 2 periods a month. And then all on top of that, she was noticing weight gain, even though she hadn't changed anything with her diet or her exercise. And then when I asked about family history, she told me that her mother had Alzheimer's disease. So we worked through the 3 pillars, starting with hormone evaluation, which showed that her progesterone was low and her estrogen was high sometimes and low at others. This is super common in perimenopause. We started her on herbs to regulate her cycle and started the conversation about how hormone replacement therapy could help for regulating her period and also for the prevention of Alzheimer's. Then we made the decision about how and when we would start that. We worked through her gut microbiome health and her ability to process her hormones, which included adding something to her daily diet and utilizing key digestive supplements to shift her microbiome. Finally, we put all the pieces in play to get her metabolism up and running again. These steps changed her experience of menopause completely. She regained control of her moods and her periods. She was able to maintain her weight and get back the energy that she was lacking. Okay, so let's review. We talked about the old science, how hormone replacement therapy was thought to be dangerous, how we don't address symptoms until the periods stop. Now let's talk about the new way of approaching menopause. Now we know that we should treat hormone symptoms early for preventative and proactive health care. We know that we want to work with the whole body to improve symptoms. This is an individualized approach. And we know that aging does not have to mean acceptance of feeling unwell or less fit or more tired. We have the power to change that. Carrie and so many more of my patients have proved this. We don't have to suffer in menopause. Okay, but I know what you're thinking. You're thinking, yeah, but I've heard that you can take control of your health, or you've tried to take control of your health in the past and you couldn't stick with it, or you were really gung ho and excited in the beginning, but it turned out to be more expensive and time consuming than you thought. Or you've already worked with a variety of different practitioners and you've not gotten the results that you're looking for. Or maybe you didn't have time or energy to take care of yourself because you're too busy taking care of everyone else. Or you've had labs done and they always looked normal. I know, and I acknowledge all those things and experiences that you've had and all those worries. I've been there and I've heard them all before. What I've created for you is something that moves around those pieces. I've created a process, a system that enables you to achieve a better menopause transition and also acknowledges what you have going on in your real life. We can do this. If this is something that cultivates some curiosity for you that you're interested in talking to me about, I want to invite you to have a chat with me. I have 5 spots this month opened up for a 20-minute free conversation where I can discuss your personalized strategy with you, your personal health journey. I'm only making 5 spots available because I'm busy in my practice and I have to reserve the time for my current patients. But I really welcome the opportunity to be able to talk to new people who are sincerely interested in moving the needle on their health. For those people who really want to achieve their health goals, in particular, a smoother menopause transition, feeling your best. If that's you, then I have a spot for you. Look, there are 2 futures ahead of you. There's the one where you stay the course, moving uphill through menopause, struggling against your body, struggling with the symptoms. And then there's this other path where you're proactive about your health. You can have a smoother transition, where you work to prevent osteoporosis, prevent heart disease, prevent dementia, where you can feel better now. Which future are you leaning into? Which path do you think you're going to take? Okay, Molly. I forgot to tell you the rest of the story about Molly. I talked to her about her in the beginning. Now, she had some of the same concerns as you. It's going to be too hard. I don't have time. I can't afford it. But she took the leap. And she was able to maintain her premenopause weight. She stopped having hot flashes and night sweats. She started sleeping better and therefore thinking better. Her cholesterol came down. She's maintaining a very healthy heart and a quick, focused brain. The work we did together, it wasn't drastic and it wasn't overnight. She didn't have to stop all the things she loved. Now she's feeling so much more like herself. It's possible for you too. She regained vitality and now has the knowledge and empowerment to move into the next phase of her life with that vitality. This can also be your path. If this speaks to you, if you're ready to talk about what your path to a better menopause is, the link is below. If this isn't the time for you, I fully respect that too. If you've got to this point in the video, that probably means that at some point in the future, this is going to feel like the right move for you. And I'm here for you when you're ready for that. So again, if you want one of those 5 spots this month, you can grab that below. And for everyone else, thank you so much for being here with me. Thank you for giving me your time and attention. I wish you all the best.